Not everyone thinks of arthritis when they think of military injuries, but it is absolutely possible to have service-connected arthritis. Hi, I'm Mike Lestrito, a managing attorney here at CCK.
And I'm Ethan Muckelbauer, a lead advocate and attorney here at CCK. In this video, we're going to discuss some key information about how VA rates rheumatoid arthritis and osteoarthritis. If you're just now figuring out how to file a claim or an appeal with VA, you can check out our blog at cck-law.com for some more information. But for now, let's dive into arthritis ratings. The first thing we're going to touch on is presumptive service connection. It's really important to know that degenerative arthritis and rheumatoid arthritis can be eligible for presumptive service connection. What that means is that VA will automatically presume that your arthritis is related to service without having to go through all the traditional elements of a service connection claim. So under 38 CFR 3.309, which is a VA regulation, arthritis is considered a chronic disease. Whenever you have a chronic disease that begins during service or within a year after discharge and manifests to a degree or 10% or more disabling, then the presumption of service connection will apply and VA should automatically assume that your arthritis is related to service. This is really important because it really helps veterans establish service connection even if they don't have all the medical evidence that would link their current arthritis to some particular incident or injury in service. So here the presumption under 3.309 is kind of like a shortcut to service connection, where veterans don't have to go through the whole process in order to get compensation.
Yeah, and Ethan, another way that we should touch on for veterans to have their arthritis service-connected is secondary service connection. And so under secondary service connection, what we're talking about is if a veteran's arthritis is caused by an already service-connected condition, then the fact that the veteran's arthritis is caused by an already secondary condition can result in the arthritis itself being service-connected. A couple examples that we've seen in our practice. A veteran has a hand injury, or maybe they have a foot injury, and after, sometimes several years, the hand injury and foot injury, which is service-connected, develops some sort of arthritis in their joints. Now, in addition to the hand injury or the foot injury, the arthritis, which is the result of the hand or foot injury, can in addition be service-connected. And so there's a link that can be shown that links the arthritis to the already service-connected hand or foot injury, thereby allowing the arthritis to itself be service-connected. Another example, a little bit more complicated of an example, but something we see fairly frequently. Take, for example, a veteran who has an ankle injury, and the ankle injury is in fact service-connected. The ankle injury causes the veteran to develop an altered gait, right? They are walking a little bit differently because of their ankle injury, and over time, that altered gait, the change in how they walk, leads to arthritis in their knee. Despite the fact that the knee condition isn't directly related to something that occurred in service, the fact that the knee arthritis was caused by service-connected ankle condition and the altered gait that resulted from it, the arthritis in the knee can be secondarily service-connected, and the veteran can receive a separate rating and compensation for that condition. If we were to flip it, alternatively, arthritis, once service-connected, can serve as the source to then service-connect another independent condition. And we see this frequently where a veteran has service-connected arthritis, and over time that leads, unfortunately, to a mental health condition, let's say depression. The fact that the veteran's depression was caused by the veteran's service-connected arthritis can allow, under VA regulations, for the depression to be service-connected and rated independently of the original service-connected arthritis condition. And so these are a few more ways that veterans and veterans advocates should keep in mind as they're reviewing a record or they're looking at their own case, a few avenues to potentially pursue if it doesn't look like the arthritis itself or an independent condition can be linked directly to something that occurred in service.
Yeah, so once you've established service connection for an arthritic condition, let's talk about how VA actually rates arthritis. And we'll start with degenerative arthritis because degenerative and rheumatoid arthritis are pretty different in terms of the rating. So degenerative arthritis is under diagnostic code 5003. It's also called osteoarthritis, and it's usually rated based on the limitation of motion of the affected joints, the same way other joint conditions are rated. However, arthritis has some extra ways to get a compensable rating. If you don't have enough limitation of motion to be assigned a compensable rating, you can still get a 10% rating for each major group or minor group of joints that are affected by a limitation of motion, even if that limitation itself is not to the degree that VA would traditionally assign a rating for. These are combined and not added to determine the rating for your arthritis. So degenerative arthritis will be given a 10 or a 20% rating based on the number of joints or joint groups involved and the resulting level of incapacitation of the arthritis. Usually VA requires limitation of motion be confirmed by observations like swelling, muscle spasms, or evidence of painful motion that are observable to an examiner or to someone else. But if there's no limited range of motion in the joints, you can still get a rating for degenerative arthritis based on X-ray evidence to confirm that there's arthritis in the joints. So you can still get a 10% rating for degenerative arthritis if you can show with X-ray evidence that you have two or more major joints or two or more groups of minor joints affected. And then you can get a 20% rating if you can show two or more major joints or two or more groups of minor joints with incapacitating episodes. Mike will talk about incapacitating episodes a little bit more, but generally that refers to the inability to perform daily tasks, to work, or to perform basic activities like standing and walking. It's important to note, though, that veterans can't be rated for degenerative arthritis and limited range of motion for your joints, so VA is going to assign a rating based on which one would result in more compensation.
So that's degenerative arthritis. Rheumatoid arthritis is a separate type of arthritis. It's actually an autoimmune disease. And because it's a different form of arthritis, it's rated under a different diagnostic code in VA's schedule of rating disabilities. Specifically, the diagnostic code is 5002. It's very detailed. I encourage you all to take a look at it and look at the specific way that the condition is rated. But that being said, the condition can be rated anywhere from a non-compensable 0% rating all the way up to a 100% rating. 100% ratings are reserved for rheumatoid arthritis conditions that result in complete incapacitation. So picture a veteran who is bedridden for constant long periods of time, very, very severely disabled. We don't see that too frequently, but we do fairly frequently see lower ratings assigned for rheumatoid arthritis. And again, as I mentioned, the specifics of the ratings are contained in diagnostic code 5002. I encourage you to take a look. But if you were to boil it down, what the DC, the diagnostic code, is really saying is that the number of incapacitating episodes dictates the rating that a veteran receives. So for example, a 20% rating typically is assigned where veterans experience 1 to 2 incapacitating episodes per year. A 40% rating results where veterans can show that they have 3 or more incapacitating episodes a year. For a 60% rating, veterans need to show that they have, in quotes, severely incapacitating episodes 4 or more times a year. But it's important to note that veterans can also show that they have fewer episodes than that occur per year for a 60% rating if they can also show that each episode is a prolonged episode. Now, the wrinkle in this is that, as is often and unfortunately the case, VA will include terminology in their regulations and fail to completely define the regulation or the terms therein. And what that leaves us is not quite knowing exactly what an incapacitating episode is or what a prolonged period is. So this can be obviously unfortunate for veterans and veterans advocates who are trying to comb through and determine what the appropriate rating is. But it can also be advantageous to veterans where they are looking to submit evidence and make an argument that they deserve the next highest rating. So keep that in mind as you are developing evidence. Perhaps you are creating a lay statement. Perhaps you are making a legal argument. These terms have the flexibility uh, for failure of VA to define them that would allow you to make an argument that the veteran deserves a higher rating than they are currently rated for the condition.
So, one other way that veterans can be compensated for arthritis is under VA's painful motion rule. So, this is cited at 38 CFR 4.59, and this states that if you have arthritis in any joint and you have pain on motion, you can actually receive a separate 10% rating for each affected service connected joint, so long as you're not already receiving some form of compensation for that disability. So, VA examiners perform a lot of different testing for these joint conditions. They'll test active motion, meaning you're moving the joint yourself, passive motion, where the examiner moves it for you, weight bearing and not weight bearing, and if possible, they'll test it against the opposite undamaged joint. And if there's any painful motion on that testing and you're not already receiving a compensable rating for that condition, VA should grant you a 10% rating for that painful motion. However, VA examiners don't always complete all of the required testing at exams, and this can result in an inadequate VA exam, meaning VA failed to fulfill its duty to assist. You're entitled to all of that testing to ensure that VA is assigning the highest rating possible, and you can argue if it doesn't include that testing that the exam is not adequate or incomplete. It's important to note that you can also get separate 10% ratings for different joints under 4.59 as long as you're not getting the same rating twice for the same joint.
So on the topic of C&P exams, Ethan, as we know, VA relies heavily on the results contained within a C&P exam. Veterans are within their right to request a copy of the examination report once it's been conducted. We highly recommend that you do that or that your representative obtain a copy. Comb through it, take a look, see if what is outlined in the report accurately reflects what occurred during your appointment. Oftentimes veterans are suffering with arthritis conditions for years, and a 15-minute exam, it can't possibly capture the sometimes thousands of pages contained within a veteran's record that really, in totality, paint the veteran's disability picture. The good news, though, is that despite maybe a veteran's examination report coming out unfavorable or maybe not showing the results that they had hoped for, as you had mentioned, there is the opportunity to argue that the examination is invalid for any one of a number of different legal reasons, or you can always submit at the appropriate times the additional evidence to help support your case. What we tell veterans who are going to be attending a C&P exam is that it's extremely important to, number one, attend the exam. And, we understand that oftentimes VA does not provide much, if at all, notice as to when the exam is going to occur. Oftentimes the exam is scheduled great distances away from where they live. They don't make it easy. That being said, we know how much VA relies on the results of a VA exam. So it's important to attend. When you do attend, it's important to be open and honest about your conditions. That doesn't just mean not exaggerating your conditions, of course. It means truthfully disclosing the severity of your condition. All too often, we unfortunately see veterans who will attend a C&P exam and they will enter the room, and the first thing that the C&P examiner asks is, "How are you doing today?" And they kind of naturally say, "Doing great, how are you?" Well, guess what? The first thing that's going to be noted in the record is veteran entered room and said that he was doing great. Disclose the severity of your condition. This is not a time to, use restraint and, fear that what you say will in some way, negatively impact you if you are in fact disclosing the full extent of the condition. This is the time to display to the VA examiner how your condition impacts you and how it impacts your functional, what we call the functional loss of a condition. So it's not just that you have pain, it's that your pain leads you to be unable to hold the tool, or that your pain prevents you from driving. And so it's connecting the symptoms that you're there to have examined with any resulting functional loss for the condition.
Yeah, and taking some time to write out what you want the examiner to know about your condition, the way it affects you in your daily life, before the actual exam can really help you make sure you give the examiner everything they need to help give VA everything they need to rate the condition. The last thing we'll talk about is joint replacement surgery and the potential for a temporary total rating whenever you undergo some sort of surgery for a service-connected joint condition. So if you have a joint replacement surgery, for example, a total knee replacement for a service-connected knee condition, you can get a temporary 100% scheduler rating while you recover from that surgery. So this provides benefits for veterans who are experiencing temporary severe medical situations related to their service-connected conditions. There are a few types of temporary total ratings and different ways you can actually get that 100% temporary rating. The first is for hospitalization. So you can get a 100% rating if you've been hospitalized for over 21 days as the result of a service-connected condition, and that includes if you have to stay in the hospital for any treatment or surgery or procedures, or are recovering from the effects of the disability itself. If you do receive a temporary hospitalization rating for a joint replacement surgery, for example, the effective date, the date you'll begin being paid out at that 100% rate, will be the day your continuous hospitalization begins. And then those benefits will continue until the last day of the month in which you stop receiving hospitalization or treatment for that service-connected condition. Another way you can get a temporary 100% rating is through convalescence. So VA defines convalescence as a period of recovery following an attack of disease, a surgical operation, or an injury. And by recovery, they mean the act of returning to a normal, healthy state. In order to qualify for a temporary total convalescence rating, there are a few requirements, though. The first is that you have to have undergone treatment or surgery and resulting in a convalescence time of at least 1 month. So you do need at least a month of recovery time from the disability or the procedure to get that temporary total rating. Alternatively, though, if you've experienced severe post-operative residuals from a surgery, so for example, a wound that won't recover, if you're housebound due to a procedure, or if you have to use crutches or a wheelchair as the result of a surgery, that also qualifies as convalescence, and you can get a temporary total rating. The last way is if you are immobilized in a cast in one of your major joints, even without surgery, that VA will still count that as convalescence and give you that total rating. For convalescence ratings, you'll begin receiving that 100% rating 1 month after you're discharged from the hospital.
All right, this seems like a good place to stop. If you're working on a claim or appeal for these arthritis conditions, hopefully you found this helpful. If you did, please give us a like. You can find a lot more information about VA ratings for arthritis on our website, cck-law.com. As always, please follow us on YouTube for more VA disability videos. Thank you.
Take care.